Good morning, everyone. I am here again this week with Christine Estle, who is the Jefferson County Public Health Administrator. And she has been very generous with her time and her information to talk to us and update us as to what's happening in Jefferson County with regards to coronavirus. Good morning.
Good morning, Erika. Thank you for having me. Thanks to you and Jason and Fairfield Media Center for making this possible to share the information with our community residents. I really appreciate it. So thank you very much.
We appreciate you very, very much and all the hard work that you're doing. I know you're putting in a lot of hours and trying to keep us safe. So thank you.
You're welcome. We have a great team here at Jefferson County Public Health. We have a small but mighty team. There's 4 nurses, including me, and 2 home care aides. So it takes all of us working together. So,
yeah.
And I will apologize in advance if the telephone starts ringing because it's just over here to my right. So
sure, no problem. And that's good information because honestly, I really had no idea how large your department was. And maybe if you could just give us a little bit of background about sorry, the cat.
I saw it.
Yeah.
So handsome.
He's so cute. Anyway, sorry, everyone. If you could just kind of let us know what the roles are of some of your employees.
Sure. I've been the public health administrator for 12 years, and I've been a nurse for 25. So lots of things have changed in 12 years of being in public health. I think the one thing that's a misconception maybe with the public and understanding what we do here is I think that sometimes people think that we only give immunizations certain days of the week and certain times of the month. And that is part of what we do, but that's only a small part of what we do. Local health departments are responsible to perform communicable disease follow-up on all communicable diseases at the local level, with the exception of sexually transmitted diseases or infections. Our state partners still perform that follow-up, so we are not charged with that at the local level. We're involved in lots of community wellness projects, grants. We have a child care nurse consultants that work here, so they offer technical assistance to daycare centers and daycare homes. Where I participate in emergency preparedness for our community. We have a grant that we work with community partners with, and sometimes we do things that we never thought we would do. We've helped our environmental health department collect mosquitoes at different times. So we do mosquito surveillance. Sometimes we help Dan with that. So it's, here it is the middle of, well, let's see, what is the date? The date's the 21st of April. So won't be long. We'll be talking about mosquito-borne illness and tick-borne illness and all those kinds of things too. So we do lots of different things at the health department.
Well, unfortunately, the light is shining on you right now due to this virus. And so hopefully maybe we can just, when things settle down with the virus, we can keep up with you and really do regular conversations about what you're doing. And the at-home nurses, do they actually provide tests? So if someone, like we talked about last week, what the threshold was for someone to come in and get tested, do they come in or do you go to them?
Actually, we used to have a Medicare, Medicaid certified home care agency along with our public health responsibilities. But a year ago, May, we let that certification go. So then we could focus on home care under the umbrella of public health. So it's really a public health service versus a Medicare, Medicaid home care service. But right now, we're not providing any home care services, meaning skilled nursing or personal care, bathing and grooming. We're not doing any of those services right now because we don't want to carry the virus into someone's home. So it's really kind of sad that we're not able to do that part of business as usual, but we want to make sure our patients are safe in their home. As far as testing, that's not something, or collecting specimens, that's not something that we do at this right now at this point. The specimens are collected at the hospital or health center or during your provider visit. Now, that's not to say that couldn't change in weeks or months, and we're always open to, things changing in the community, things changing with this response. So that is something that we could be charged with at some point too, to help maybe with a drive-through test or something like that. We just don't know what that's going to look like in the future.
And then your department handles the specimens and takes them sends them to the appropriate labs?
We do not. Now, if say we're doing a communicable disease follow-up, say on a TB patient, a tuberculosis patient, we do go collect specimens, sputum specimens for those individuals, and then we collect them and then we send those specimens to the state hygienic lab. But with this COVID-19, with this coronavirus, we're not actively doing any specimen collection. But with other communicable diseases, we are involved with different collections and then processing, getting things collected and then sending it off to the state hygienic lab. And people don't realize that. They just, I don't know. It's just, I think public health is one of those things that people don't realize the kind of the quiet infrastructure that goes along with all the public health services until we see something like a pandemic or an epidemic or a foodborne illness. And then it's like, oh, geez, what are we doing now? Well, public health has been doing business as usual. So
yeah, absolutely. And incredible jobs that you guys do. So this kind of goes into numbers. Right. I know that there's a change since the last time we spoke in terms of positive tests.
Right. Right now, at this point in time, at 10 till 10 on Tuesday morning, April 21st, we have 6 laboratory confirmed cases in Jefferson County. Those numbers are usually released late morning or lunch time. We're trying to do it once a day, along with when the state releases their numbers, because it gets too confusing. It ends up everybody's just chasing their tail, so to speak, because the hospitals release numbers, we're releasing numbers, the state's releasing numbers. And the one thing I want to, and I know our health center is doing this as well, they have a disclaimer now on their website saying that our numbers, I can't remember exactly what it says, but something to the effect of those numbers that they're sharing are numbers of individuals that have been tested at Jefferson County Health Center. Keep in mind, not everybody that clinics at Jefferson County Health Center lives in Jefferson County.
Right.
So you could have patients from Van Buren County, Wapello County, wherever, but the numbers that we are following up on, the numbers that we are releasing at the local health department level are individuals with a Jefferson County address, just like the state health department. So that's why you might see a variation in those numbers.
Interesting.
I said that before, but I just want to make sure everybody understands the difference in the numbers sometimes. So.
Right. And are you doing contact tracing? So do you interview people if they test positive? We do.
And that is a normal procedure for all communicable diseases.
Okay.
We get that information through our local partners actually, once it's confirmed, it comes through the Iowa Disease Surveillance System, or we call it IDS. It's a highly secure computer system, and certain people have access to it here at the health department. We get the individual's information, test results, address, phone number, all of that, and then we contact the physician or the ordering provider first to make sure that they've contacted the individual, and then we contact the individual to make sure, hey, are you doing okay? You know, depending on what's going on, are you on medicine? Are you not on medicine? Who else is in your household? Is anybody having symptoms? We do this with TB, pertussis, this COVID-19. So for us, this is normal practice with communicable disease follow-up.
Sure. And none of these 6 positive cases have needed to be hospitalized? Or maybe is that never mind.
With my hesitation, you can probably tell that.
Yes, of course.
And I have to be careful with what I release.
Of course.
I can say that we have 6 lab confirmed cases. I can say that 3 have recovered. So 3 of them were not even on our quote radar, so to speak. They're back to work, back to life as normal before, as normal as can be. So I don't want to get hung up on that.
No problem.
So we have not had a confirmed death that has been related to COVID-19.
Very good.
So,
That's great news.
That is great news. Yes.
I understand that since we last spoke, we talked about your personal protection needs. Has that changed? Is there a call of certain items that you need more than others?
Right now, I think we're doing okay with masks. We're still accepting cloth masks. If anybody wants to donate, that's fine. I put a couple of our staff members on task to do that and help with that. So our nursing homes, long-term care, assisted living, dialysis center, some law enforcement, all of the apartment complexes, Kalu, Logan, Wagon Wheel, we have made sure that those individuals have all either received 1 or 2 cloth masks out in the community, other members of the community. So we're trying to share those masks as much as we can. Sorry, there's the phone. I'm surprised it took that long, really.
Yeah.
So we are working on that still. And then I do know that we have been working with the gown committee, so to speak, the cloth gown committee. We currently actually right now are waiting on fabric to come back to the health department so we can distribute it. I know I had someone pick up fabric this morning. So with community support and donations, we're able to purchase fabric by the bolt at the Dutchman store in Cantrell.
Yeah.
Because it's like 60 inches wide, which is a wider fabric than sometimes is available in mass quantities. The goal is to make 500 isolation gowns or PPE gowns for our staff. I did talk to, not our staff, but the healthcare staff as a whole. So we're still working on that. We should have more fabric brought up today. We're waiting on a little bit of additional fabric to come in at Dutchman's, and then they'll call us when that's here. So just call the health department. If we have fabric, you're welcome to come pick it up.
And patterns, you have patterns available.
Yep, we have the instructions available. We have the bias tape available to make the strings. All we need is somebody to sit down and go zzz with their sewing machine and whip out some gowns.
I know we have a lot of very talented seamstresses in town that would be both really, really happy to be able to help. So hopefully they'll hear about this.
We're so blessed. We really are. You don't want me sitting down at a sewing machine because I get really frustrated sometimes, but we've had great community support and more to come on that.
Okay.
I will say just right quick, I did talk to Stacy Worley the other day I talk to her every day from the health center, and we were talking about if a patient is on, this is just a generically speaking, if a patient is on respiratory precautions, meaning they maybe have tested for COVID, maybe they're waiting on results, maybe they tested negative, but they still need to have appropriate protection for the staff, they could go through anywhere from 40 to 45 isolation gowns in a 24-hour period per patient. So that means the nursing staff, that means the hospitalist, x-ray, lab, whoever may have contact with that patient in a 24-hour period. So that's the volume of gowns that we're talking about, isolation gowns that we're talking about per one patient.
Yeah. Yeah, that's an astounding number.
It is. And I said, Stacy, do you think this is right? She goes, well, yeah. And then if that patient needs a higher level of care, you're going to be in and out of there even more. So that's just, it's not like we're going to put one gown on and leave it on all day. It's not like our scrubs.
Right.
So, we're used to just pulling the gown off and throwing it in the trash. And now, they still have gowns.
Yeah.
Yes, exactly. So then that's going to increase laundry services and all those things. They still do have gowns, but disposable gowns. And Brett Farrell, our emergency management coordinator, continues to request them. However, we know with the increased numbers in Iowa, we're only going to get so much stuff sent to us, regardless of what we ask for.
Yeah. Speaking to the full, to the entire state, it looks like the numbers are doubling every week. Am I right?
Yes.
And is that mainly because of the meat packing plants and things like that, or is it more generally community spread? Explain that.
I almost think it's all the above. I think it's once we have community spread, that's just it. It's community spread.
Yeah.
And everybody that we have contact with, you need to treat them as they could potentially be positive for COVID-19. And that's something that people struggle with.
Yeah.
Because they could be asymptomatic or whatever the case may be. We are seeing increased numbers at our meat packing plants because they work in such close environments. Mm-hmm. And then oftentimes those individuals carpool from point A to point B. So then you're in a vehicle together or you're in the same family.
There you go. Mm-hmm.
So, and then also we've seen a significant increase in our long-term care facilities in our nursing homes because that population, our older population, is vulnerable. They oftentimes have other comorbidities or other health issues that go along with the aging process.
Yeah.
It's sad to say that, but unfortunately that's true. Yeah. Our bodies aren't what they were at 25, at 50, or at 75. And
Yeah, yeah, yeah. No, ask me when I wake up in the morning. It's like, is this
No.
me? It just snuck up on me.
I know. It's like I woke up and I'm like, how did I have gray hair? It's like, oh my God. How did I have
Well,
spots? It's like, I'm still 25 in my mind, but my
I
body's
know
not
it.
doing that.
I know it. So we take good care of ourselves as though we're 60, 70 for sure.
We try. So,
try.
and then I think too, we're seeing more testing being performed. And
Yeah.
I think the frustration that comes with being in Iowa is we see things that are going on the coasts. And then, here we are stuck in the Midwest, or I don't see it as stuck. We're like, yay, we live in the Midwest.
Yay. Yeah.
I personally like living in the Midwest, but you can't compare Iowa to New York to California. So when they have drive-through testing or they have testing more accessible, every place looks different.
Yeah.
And I just can't stress that enough. I just, and then you get on social media and then it's like, oh my goodness, I did not know that we had so many armchair epidemiologists. We play armchair quarterback all the time. Well, not now, but everybody's an authority. Everybody has a medical degree. Everybody knows everything. And it's like,
yeah.
Okay, let's look at this objectively. And, in a couple of years when we know more about this virus and we look back, we're going to say, why did we do that? Or I'm glad we did that. Or we should have done this. We're doing the best we can with the information that we have right now. Exactly.
And it is a process. It's not like, where we grew up, in my era with measles, and we don't realize the process until we're actually in the middle of a process. It just doesn't happen overnight.
Exactly.
Yeah.
Exactly. And I remember when I was a kid, I remember having chicken pox.
Yeah.
I remember having mumps. I remember getting my measles vaccine. So I remember those things.
Yeah. Yeah. But they just didn't come out of thin air.
No, they didn't. And I will say this, I know people are pushing and pushing and pushing for a vaccine. I was your public health administrator when H1N1 arrived on the scene. And, we did have a vaccine available in limited supply. And then by the time it was all over, we ended up throwing out and wasting hundreds of doses of vaccine.
Wow.
So people are complaining that we don't have a vaccine. Well, if we had a vaccine, would you get the vaccine? So everything takes time. It is not like it's not like drive-through healthcare.
Yeah.
Vaccine production, medication production, all of those things take time.
Right. Okay, well, this is great information. And in the meantime, we just do what we can to stay healthy and protect our loved ones and the public, which is what we're doing.
Right.
A little bit of a controversial question. What is your feeling about, I know that there's a lot of pressure around the country and in this state to open. And so what are the consequences if we do open too soon? Or, just too soon in your mind?
That's a great question. I think that we're seeing increased numbers right now. And I know that what I have seen with other counties and talking to other public health professionals is, and I think I said this before as well, we're seeing people become positive or symptomatic towards the end of that 14 days of incubation.
Wow.
So if you take 14 days and then exponentially you just continue it, it's kind of like when the cruise ships, everybody just kept getting reinfected and then you have to start 14 days over.
Yeah.
I think that we need to be objective, and I think that we need to try our best to stop the spread right now. I think that getting antsy and saying that what we're doing isn't making a difference is misinformation. I think that we're doing everything we can to stop the spread of it. And I think there's more things that can be done, but I don't have, I'm not privy to all the information that the governor has. It's easy for me to question her decisions. Sometimes I get frustrated with her decisions.
Sure.
But that's why she's the governor and I'm not. But I think that we still need to hold our horses, so to speak, and just be more patient. And it hasn't even hit here in Jefferson County yet, really. I mean, we're only sitting on 6 confirmed cases.
Sure.
We know that there's more individuals that are sick. So I think we need to be cautious. And again, we can't compare Iowa with New York because they started long before we did.
Yeah. So everyone should be functioning under the assumption that there are more than 6 people in Jefferson County with
Yes.
the virus in
Yes.
whatever form it can take, whether it's
Yes.
asymptomatic or you're just kind of not feeling well. And
Yes. And if
yeah,
you're not feeling well, you know, something's off, you just don't feel right, stay home.
yeah,
And I just have to request people to do this. I can't mandate it, but if you need to go to the grocery store, please, if you can't do online shopping, just one person go to the store.
sure. Yeah.
Just one person. I have a daughter that works in retail, and she works at a grocery store. Used to work here in Fairfield for many, many years, recently transferred to a different store. And, you know, one person or one cart, there's like 5 or 6 people. It's like
I've seen that.
the whole family does not need to go to the store. It's not a social event.
Right.
Even though we are very social beings,
Yeah.
at least think about the people that are working in the stores.
Yeah, that's right.
And you know, if you all want to go to the store as a family, then one person just go in. Everybody else can sit in the vehicle.
There you go. There you go. If it's about a ride just to get out of the house, then that's just what it is.
Right.
Yeah.
Right. And I get that. Everybody's getting claustrophobic. Everybody's feeling very stressed and, you know, spring fever, so to speak. And that's fine. You can get out, you can go do things, but make different decisions when you go
Okay,
to the
that's a
store.
great reminder. Excellent. And I read this morning and then on the national news that the first at-home test is now available. Do you know about that?
I do not know anything about that. I am not surprised, but I'm not surprised.
Yeah. So maybe the next time we talk, there'll be more
some-
information. You'll know more, and we can maybe dive deeper into that, which would
Right.
be great. And are you doing, or are you ramping up, or is there any conversation yet about immunity testing?
Antibodies.
Antibodies. Yeah.
Mhm. Yes, there's been that discussion, and I know that they're learning. The state and the CDC are learning things every day from individuals that have tested positive, that have experienced COVID, and that's how we understand how diseases work, how viruses work, and by doing antibodies, and it's how vaccine development works as well. And all these things have to come together, and we have to have the information from those individuals that have been sick to give us information so then we can move forward.
Yeah.
It's so convoluted sometimes, but
well, we're figuring it out.
yes.
And once again, we appreciate so much what you're doing and being on the front line of keeping us healthy and keeping us informed, and you and your entire staff. We really, really appreciate it.
Well, thank you very much for taking time to talk with us. And it takes all of us working together, that's for sure.
Yeah. Yeah. Unless you have anything you'd like to add, I think we've covered quite a bit this morning. And
I would just encourage people to, I just want to make sure I have my other computer up. Just go to the state's new dashboard on their website. It's coronavirus.iowa.gov. And it gives a lot of information in a different format, and there's different tabs you can click on. It's great, up-to-date information. So
fantastic. Well, thank you so much, Christy. We really appreciate you.
Thank you very much.
All right. We'll talk to you next time.
Okay. Thank you.
Okay. All right. Are we ready?
I think so. Yo.
Oh, gosh. Okay. Good morning, everyone. I am here again today with Christine Estle, who is the
You touched your ear.
I did, but I also was going to say head administrator. That just doesn't sound
Public health administrator?
Yeah, public health administrator.
That's okay. It's all right. It's all right.
Good morning, everyone.
Oh, your cat just jumped in the back.
Keep that in.
Is that a Siamese cat?
It's a Blue Point Himalayan.
Oh my gosh.
He's a combination Persian Persian Siamese.
My daughter is a vet tech, and she would love that cat.
He talks. I mean, I just had to let him out because he was complaining. Now he wants to go back in.
Oh my gosh. What's his name?
Mojo. Well, blah, 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 blah. You know, it's just like choo 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 choo. That's really more his name.
That's awesome. He's beautiful. He's handsome. He's handsome.
Oh, he's so sweet. He's such a good boy.
Oh,
Right?
gosh.
He may just kind of.
That's all right.
Okay.
I just got distracted. Sorry.
I know it. He's so delicious. All right. Well, this is good.
All
Okay.
right. Perfect.